Hi, my name is Julian Worcester. I'm the Director of Children's Services with Somerset County Council. One of my key priorities is setting up and ensuring we've got good early help services in Somerset. Ofsted identified quite rightly that we're not doing enough around early help. It's a responsibility for all of us who work with children and families. Early help is very important for children and families to make sure that they get the right intervention, at the right support at the right level. We know that some families are having services which could be supported better by agencies working more effectively together, and they have a right to those services. It's actually statutory guidance in Working Together 2015, which was recently revised. It talks very much about the need for professionals working together, providing an early help assessment and an early help plan. I'm committed to working and making sure that that's in place in Somerset.
Well, for me, I think early help is everybody's responsibility. I think we as the police will probably be there at the front line. For that, I mean going really from the grassroots level, where we're looking at children that are maybe not at school or are in the streets or are at houses that we go and visit, and just asking those questions to the child, how are they, what are they doing, why aren't they at school?
We are committed to assigning our staff to early help hubs. For example, health visitors, school nurses, primary mental health workers and young parent practitioners to work in each of the local areas.
We absolutely have a focus on children. Quite important for us as a system leader for health is that piece about reminding everybody about their responsibility to the child. I think there's multiple challenges for everybody. It's a very tight economy that we're working in at present, so everything that we do, we need to always ensure that we're getting the best possible value for money and the best possible outcomes and the best possible quality for every Somerset pound that we spend.
We've gone through a recent force restructure, so I think like other partner agencies, our resources are stretched, and we need to make sure that we've got our officers that are based locally to help partners to get there quickly to deal with children, because now we are all based in hubs.
There are so many things within our jobs that can distract us. I think back to a situation with a discussion I had with a staff member, and she kept saying to me, it is the principle of the matter, it is not my job to do this. And when I said to her, what about the child and the family, she was very clear that actually, if she thought about the child and the family, she thought differently. There needs to be a clear expectation for integrated service delivery, and we need to think and agree how we can effectively use the resources we have available. We have made some progress with information sharing, but we need to continue and progress this work.
We need to have services in place that are resilient, that are enabled, empower the children and the people who care for them to do the right things.
The important thing for me is to have those honest conversations, be honest with our partners, understand what our roles are with our partners, looking forward to what we can deliver. But the main thing, which we mustn't forget, is about, at the end of the day, it's about protecting the child.
It's the right for children and their families to get the help they need at the right time.